Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, good morning. Welcome back to Insurance Matchmaking. And I'm going to be the professor of doom and gloom, or the prognosticator, or whatever. I'm messing up the term. But anyway, the end is near. You know, used to see the old caricatures, the guys walking around with sandwich boards or carrying a sign, you know, the end of the world is coming, the end is near. Well, the end is near when it comes to enrollment season. Believe it or not, as we are speaking today, if you're listening on the radio to the original air date of this program, it is December 6th. December 7th is the deadline for the Medicare Advantage and prescription drug plan annual enrollment period. I get a little frustrated that even CMS keeps calling it open enrollment when they've named like three other things open enrollment. It gets very confusing, but it is the annual election period. If you have a Medicare Advantage, it's not the end of the world. I've mentioned this a few times on the program. We do have the first 3 months of the year that you can change your Medicare Advantage plan because you have what it's called the Medicare Advantage open enrollment, which that is officially titled open enrollment period. And you can change your plan to another plan as long as you complete that application prior to March 31st. It will take effect the first day of the following month, whichever one of those 3 months you do that application. That's your last chance to change your Medicare Advantage plan until this time next year, unless you qualify for some other special enrollment period. And last year we had a lot of, because of hurricanes and such, and some fires, there was a lot of disaster, what we call SEP, special enrollment periods. I don't know that's going to hit our area this year so much. I don't know. I can't think of that. I don't think we have an active FEMA disaster special enrollment criteria. But if there is, what happens on there is when they put that out, and like I said, it may apply in some other states, is you can say, well, I didn't get it done during the annual enrollment period because of this disaster changed my schedule. I was displaced because of flooding, whatever and you don't typically have to really justify it. It's just, hey, if you didn't take advantage of this enrollment period in a disaster, SEP covers that period. You can do it at a later date, but I can't think that we have one in our area this year. We did last year because of Hurricane Elaine. But anyway, December 6th is Saturday. As you're listening to this, I am probably already in the office. And if you need to do something with your Medicare, you need to call us or come by the office today and get that done. I do not plan on working tomorrow. I haven't had to work Sundays this season. I have done it a couple times in the past, but that was, again, goes back to what I used to call my road warrior days, where I was making the house calls, and sometimes the only way I could get to somebody was like on a Sunday afternoon. And it would just be a one-off. It may have been they were not kind of in a circuit where I could go to this house, and this house, and, cover 3 households during that day with my drive time because they were completely the other direction. So sometimes I would make some exceptions and even, or meet somebody at the office on a Sunday afternoon because that was the only time we could get together. Maybe they were working in their work schedule. Sunday was the only day they had available. So I would do it as an exception, but I'm not planning on working Sunday, December 7th. That is the last day of the annual election period. It's critical for drug plans, the Part D drug plans. We don't have a second do-over the first quarter of the year like we do at the Medicare Advantage plan. So if there's not anything critical happening right now with your Medicare Advantage, and you will be okay with having that plan on January 1st, but maybe want to change, let's set up a time in January or February to get together, and we can still change your plan if need be. Let's save this time for those that really need to do something. The other thing is that there's some plans that are going away. So that gives you a special enrollment period. So in fact, actually, if your plan is one of those that's ending, we can enroll you after December 7th, and we can use a special enrollment period because you're losing coverage. And that basically will extend until the end of February, because anytime you lose a plan with any health plan, basically you have a 63-day grace period, basically 2 months, but they say 63 days because some days are 30, some months are 31. So you do basically have until, but it'll be the end of February on this one. It'll be a 2-month SEP because you had notice. But one of the big things with if you have a Medicare Advantage plan that is going away, that does provide you the opportunity to get a Medicare supplement and get it guaranteed issue. So the beauty there is maybe your health is not good enough to qualify to get a Medicare supplement based on the health underwriting with that guaranteed issue because you lost your plan. That gives you that opportunity to get a Medicare supplement. You don't have to, but some people are electing to do that. You will need to get a drug plan. So you need to get the drug plan in place. So we are in that deadline. The special enrollment period should still extend for the drug plan, but if you're needing to do a drug plan, we need to do that now. We still will have the guaranteed issue period. We'll have the special enrollment period for changing plans to get that Medicare supplement in place. So again, you have some time left, but we want to try to get those in place. The other thing is, and I always talk to people that are thinking about doing a Medicare supplement that aren't losing their Medicare Advantage plan and would have to qualify health-wise, we would need to put in an application to change your Medicare Advantage to a drug plan. So since we are up against the deadline at this point, I would do an application for a Medicare supplement to begin the 1st of February. In that way, we could find out, we get the underwriting decision of whether you're accepted for that plan, and then we could do an application to change your Medicare Advantage to a drug plan. Because again, I mentioned that open enrollment period, the first 3 months of the year is we used to have what was called the Medicare Advantage disenrollment period, and that was the first month and a half. We had to February 15th to do that, and then when they switched, and I can't remember what year it was, but it's been about 6-7 years now. 6-7 for the disenrollment period, and then they switched it to the Medicare Advantage open enrollment. And actually, maybe even been about 8 years ago. I'm not sure, but we've been doing it I've been doing this so long, it's kind of the years kind of blur together. I started in the health insurance industry. I started, as I mentioned before, I did a year with Aflac in 2013. In 2014, I went to Health Markets and started doing the health and then also the Medicare. So I've been enrolling people in their Medicare plans for 11 years now. It was 2014 for the 2015 enrollment year. And so, so I've been enrolling people. So it'll be 11. This is my 11th AEP, as we call it, annual enrollment period for Medicare. So the years kind of run together on that. And then the drug plans, though. But if you just need to change your drug plan, we need to do that, today. If you haven't done that yet, like I said, you need to get hold of me today, or you need to go to Medicare.gov and switch your plan. Now, if you go there on Medicare.gov, because they've made it where there's a lot of plans, I can't even enroll you in them. I can just kind of direct you to Medicare.gov. I can do the searches and kind of see which plan would maybe work for you. But if you go to Medicare.gov and select and click on the Find Health and Drug Plans, and then there's a link, and then if you're just looking at drug plan, you click the link for the prescription drug plan. You follow the links. There's several different successions, but one of the things it'll ask would you like to compare your drug costs? And I strongly encourage you do that. I mean, if you're taking one or two generics like a lisinopril, atorvastatin, losartan, just regular blood pressure medicines, those are all going to probably be tier 1 generic. Yeah, you probably could go with the cheapest plan out there. But if you're taking some tier 3 things like Ozempic or Eliquis or Elto, it may be a generic, but you're still paying a premium premium. You're paying a copay where you're not paying copays on some of your other prescriptions. That's going to be a little bit more expensive drug. You definitely want to see which plan, how they handle that drug, because otherwise you may just be out of pocket for it. But I know like some of the plans went up like $50 this year. And there are plans out there at lower premium, but you need to make sure your drugs are covered on those plans. So definitely double check that. But if otherwise, you're going to have the same drug plan next January. So if your drug plan went from $50 to $90, if you don't change that plan, you're going to be paying $90 a month. Now, all the plans had to send out their annual notice of changes back in September. You may have just thought it was junk mail and tossed it. There are ways to go online and search for those also. You should have a member portal with your plan, so you can do that. So those are some of the things that, it's kind of critical. As I said, we're at the deadline. It's not just the time is running out. I mean, time has run out. If you haven't done anything about your Medicare today, then plan on that being what your Medicare plan is next year. Now, also, just a reminder, if you're brand new to Medicare or you don't even have Medicare yet, you're turning 65 in the next month or two, this is not your deadline. This deadline is for those that are already on Medicare and already have a Medicare plan. And I use it, they're not just turning 65. Maybe you're going to retire from your job in January and you're 67 to 69, or even, you put off getting a Medicare plan. You're going to have special enrollment leaving your employer, and you may not have Part B. So that is something that I can help you out with also, to make sure that you have a Part B in place. I can help you with that application, and we can get your Medicare going. And that's something, we've got time for that. You don't need to come in today. You can actually come in next week. As long as we get you done by the end of December, your effective date will be January 1st. So you may not have cards yet. You may not have proof back from Medicare that your Part B is in place yet. But if you already have Part A, it's a simple process to get you going. There is a form you do need to get from your employer. And again, if you don't get it from your employer, it can be filled out. We just need some other proof to prove that you were on a group plan since you turned 65, so you're able to enroll and you're not penalized for late enrollment. And this is a reminder to anybody who maybe didn't sign up for Part B when they were supposed to, and they were told they have to wait. We can do that in January. We can apply for your Part B during what's called the general election period, and that is for general enrollment period, I guess is the E there. Enrollment and election kind of get interchanged, but that's when you can sign up for Part B if you didn't sign up for Part B when you're first eligible and you don't have a special enrollment, like leaving an employer plan, or leaving your spouse's employer plan too. It's the same applies. We can enroll you for Part B, but you will have whatever the Part B late penalty is, depending on how many years you didn't have Part B, and it's 10% of the current premium times the number of years. So, if it's been 5 years, you're going to have 50% of that premium added onto your Part B, and you're always going to have that penalty. The premium is always going to be that additional. As I've mentioned last week, I think it might have been the first time I had the number. The Part B premium is $202.90. Might as well say it's $203. So that was part of your Social Security raise. We can help you with that. But one of the things you need is CMS Form L564 is the form. You can Google it. You can print it. I can email it to you. I have a copy of it saved. If you can't get an employer to sign that, you still have to fill out the form to attach it with your application for your Part B. But as long as we have the other proof, like a pay stub showing that you've been paying your premium on that, and a copy of your medical ID card that you had an active plan. If you have that proof of that active plan, we can submit that with your 40B as the number application for the Part B, and we can do that online in my office. That's what I like to do when somebody needs my help with that. And you don't have to be in my office as long as you have sent me that form or either dropped it off, scanned it, and emailed it to me. As long as I can get a PDF of it and attach to that application, I can complete that application online for you. One of the things on that process is once I complete it, it sends a confirmation email to you, and you have to and I think it's just open the email, click on the link that you got it. Yes, you applied for Part B, and then that will go forward and start your Part B process application. So I'll get more into that later. We're on the break. After the break, I am going to talk about the ACA issues.
What are you dreaming of this holiday season? If it's faster internet and a lower cell phone bill, TriLight Mobile can make your holiday dreams come true. Internet plans that start at just $34.99 per month, and your first cell phone line can be free. TriLight Mobile makes it easy to switch, and if you like your current device and number, you get to keep them. TriLight Mobile, it's better wireless from the company that brings you better internet. Call 844-874-2355 or visit TriLight.net to get started today. Some restrictions apply.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back to Insurance Matchmaking. Before the break, I was talking about the deadline for the Medicare. This is December 6th. If you're listening to the original broadcast of this on the radio, if you're listening to this later date, it doesn't really apply because it'll already be in the past. But December 7th is the deadline for the annual election period for Medicare, and that's for Medicare Advantage and prescription drug plans. If you have a Plan G or Plan F or Plan N Medicare supplement, this is not a deadline for you. We can apply for a new Medicare supplement any month of the year. If you want to try, we still have time to get one in place for January 1st. If you have a Medicare supplement and are looking for maybe to change your plan to get a lower rate, or maybe you signed up for a Plan G and realize, hey, if I get Plan N, I can save another, $30 to $40 a month. So that's an option there. Also, I've been recommending a lot of people consider the high deductible G, and you do have the exposure of about $3,000 out of pocket, possible up to $3,000 out of pocket, but it's generally about $100 less than a traditional Plan G, and I usually recommend that look at a hospital indemnity and cancer plan to kind of fill those gaps, because the neat thing about those hospital indemnity and cancer plans, they don't go up as you have birthdays, whereas your Medicare supplement is going to go up. But that high deductible G, if they do have rate increases, it's usually a lower percentage than the traditional G, and it's also you're starting at a lower amount, so even if it was the same percentage, your rate increase for your monthly premium will be less. So anyway, I said before the break, I was going to talk about the Affordable Care Act, because we are approaching it is the end of the world for that too. As of right now, as I'm recording this, December 15th is the deadline to change your Medicare. I've been saying Medicare so much. Your medical plan, your medical insurance for January 1st. So a lot of people have gotten the letters, and in the rates of the insurance have gone up about 35%. That was not due to the government shutdown. That was not due to the one big beautiful bill. That was just the rate increase that the insurance companies put on their plans. Now, the original tax subsidies that have been in place since 2014, the formulas there are still the same, and those rates did take into consideration quite a bit of that. I actually had one client whose premium went down on the same plan. So the increase did raise the subsidies, but the problem is when you have a 35% raise in subsidy and a 32% raise 35% raise in the insurance plan and a 32% raise in your subsidy, your net premium is going to be more. A lot of people think, why is there not a zero premium plan now? Or my plan was $30. Well, your plan wasn't $30. I think that's sometimes we get in it, and a lot of agents are presenting it. Oh, I got this zero plan, or I got this $50 plan for you. That's with the subsidy. Because if you go and look, if you're getting a $1,400 subsidy and you're paying $40, well, your plan was over $1,500. Yeah, so that's the actual premium of it. It's with that advanced premium tax credit that lowers that monthly rate. So unfortunately, a lot of people are seeing their net premium much higher. And it's like, so their responsibility has increased. And I'm not trying to downplay or saying, you shouldn't be concerned that, hey, you were paying $50 and now they want you to pay $300. No, I get that. But we've moved a lot of people to a bronze plan for that. But here's the issue of what we used to always do is say, hey, if you like your plan, you don't really need to do anything. Your subsidy's going to change. Or sometimes I would look it up and say, oh, yeah, you were paying $30. It's going to be $45 this year. And everybody's like, oh, I can handle that. And that was not a big deal. But when you go from $30 to $280, now you're upset, or it could be even more, especially if you're on one of the silver or the gold plans, because those increases really hit you hard. So I've had some people had silver and gold plans, and they're electing to go ahead and get a bronze plan this year. Some of them are getting a zero premium bronze. Some of them are getting a low premium, lower premium than what they were paying for their silver. But now you have a lot more out-of-pocket exposure. So that's one of the things we do is in our office is figure out what it's going to cost you. But I've been highly recommending people consider that bronze plan. The one plan that I recommend the most, and I'm not going to say the name of it here because I could get myself in trouble compliance-wise, but it is a bronze plan, and it has co-pays for doctor visits. Of course, they're higher than the silver plans, but that plan is also HSA eligible. You can contribute money into a bank account, and there's limits of how much you can contribute to that and claim taxes and reduce that from your taxes. And so then when you take the money out of that account, you can use it to pay for medical expenses. And so it helps you save some of the money, pre-tax wise. The other thing is we're coming up on the end of the year. It is very critical. It's crucial that you file your income tax if you're getting the tax subsidy for the marketplace plans in that subsidy. And if you are married, you do have to file jointly. I know some people, because of, one's self-employed, one's working for an employer, and so maybe they're filing tax separate, or the one's not, or one's filing as head of household because the other one is drawing disability, in which is not taxed. The Social Security and disability are included as income when it comes to calculating the tax credit for your marketplace plan. So you do have to file jointly, and just have to remind people that's part of. We kind of sometimes go a little quickly through the I agree statements at the end of the application. One of those is I agree that I will file my income tax, and if married, filing married jointly. So that's gotten a couple people in the past. They say, well, we don't file tax, we're only drawing disability. And it's like, no, I told you when I enrolled you. You've got to file income tax because you're getting the tax credit for your health care. You didn't have to file because you weren't getting a refund because you hadn't paid anything in because you weren't a W-2, but you do have to file income tax if you are getting the subsidy for your Affordable Care Act. It is called the Advanced Premium Tax Credit. It is governed by the IRS that whether you keep that subsidy or not. So the marketplace basically is an arm of the IRS is probably the best way to put it, even though it's weird because the IRS handles the financial part of it, and the Health and Human Services sets out the guidelines of how it's going to work. I don't know if the enrollment period is going to be extended. I kind of half expect that December 15th may not be a hard and fast deadline. We did have the government shutdown, which a lot of people were holding off on making any changes until they knew if they were going to have the enhanced subsidy still in place. So there's some things that we do want to make sure, but we still want to shoot for, we got 1 week from today to get those done. And my office will be open on December 15th. I'm sorry, I'm doing the dates wrong. The December 15th is a Tuesday. It is a Monday. So you do have it till a Monday on the 15th. And like I said, they may extend those days a little bit. So you have a little bit more than a week from now to get the marketplace done. I was thinking we have 8 days after the deadline for Medicare, which is December 7th. I just always think of it as being one more week, but it actually is 8 more days. So Monday the 16th, we still can submit application. Monday the 15th, we can still submit applications for the marketplace. And if you're trying to call the marketplace and get anything done on that day, it's going to be very hard because it is the last day and everybody's calling in. And that's one of the things that has granted extensions in the past, that people called and they had, 1 hour or more hold times, couldn't get a hold of somebody before midnight. And so sometimes we don't know that on the 16th. A couple of years ago, it came out on the 17th. So, we've extended to the 18th, but they didn't tell us that on the 16th. So I was telling people, I'm sorry, it's too late. But generally after the 15th of the month, when you do a marketplace application, then your plan is going to take effect on the first of the month following. Not the immediate following month, but so after the 15th of December, your effective date would be February 1st. So the open enrollment period is not closed until February or January 15th, but as it stands right now, after the 15th of December, your enrollment would take effect on February 1st. And the reason I bring that up is if you have a plan say you're on that silver plan and it went from $200 to $600, and you want to change, but you didn't make the change until after December 15th. You might switch to a bronze plan and go down to it being maybe $100 or $0 or $50 or whatever, be less than that silver. You're still going to need to pay the premium for the silver plan for January because you missed that deadline. If you're staying, you might be able to get away with not paying it if you switch to a different company, but if you just switch from silver to bronze with the same company, they're going to require you pay what your premium that's in arrears until you can have your new plan effective. I've had a couple people that have had some mess ups with losing their tax credit because they didn't submit their proof of filing their income tax, or they didn't get, maybe they didn't file 23 or 24 tax return, and so the marketplace says you have 90 days to get that updated or you're going to lose your tax credit. Did have that happen to one individual that their December rate went way sky high. Once they file their income tax and get that all straightened out, the tax credit will still apply for that month, so they should get that reimbursed on their taxes. But they needed to keep the plan in place. It's a lot of money, but got them straightened out for this coming year. But in the long run, sometimes that bill may seem too high, but if you can pay it, and like I said, if it was a matter of losing the tax credit, you were approved for tax credit before, you just need to update your proof you submitted on that. Because one of the things I've ran into also, people think, well, I don't qualify tax credit, so they just apply and say I'm not applying for the tax credit. I had somebody a couple years ago that they qualified for a $1 tax credit. So I said, hey, just fill this out and go to that you want the tax credit. Take that $1 a month off your plan. If you overestimated your income when you file your income taxes later, you can get, so you then you'll be entitled to more tax credit, and you can get that back. But if you didn't in the beginning say, I want to see if I get the tax credit, they don't let you get it after. You had to been in the process. You had to request the advanced tax credit. Now you don't have to take it. You can say, I want to defer it, but you have to request the computation when you do your application. But if you say, I don't want to see if I can get tax credit, you can't come back when you file your income tax and say, hey, I should have got tax credit. My income was less than I expected. No, you have to request it up front. So it looks like I'm out of time. As I said, next week I'll probably do a little bit more reminder again about the end of the marketplace, but keep listening to Insurance Matchmaking. Also, I need guests for my show. I don't want to just sit here and talk. I'd like to interview people and help you get to know some people that can help you with other things. So if you've got suggestions or you would like to be a guest, go to insurancematchmaking.com and fill out the ask a question for the show. There's a contact form on there. Until then, we'll talk to you next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.